Hello. All right, so this week is the last week we're going to do on the water element series. For those new to the series, I'm Michelle Marisi, licensed acupuncturist in the greater Providence, southeastern Massachusetts area. And throughout the winter, we've been talking about the water element, the kidneys, the bladder, which are all associated together, the winter season. And so we're finally coming to a close. The spring, I'm choosing to believe spring is in the air, and so we'll be moving on next to the wood element. But yeah, for today, for our last week on the water element, I'm just going to briefly cover some pathologies of the bladder. So as with the functions and the common causes of pathology with the bladder, there's fewer than with the kidneys, as tends to be the way with yin and yang organs. The yin usually has more going on, although they all play their vital roles. So with the kidneys, essentially all the patterns were deficiency patterns or rooted in deficiency. With the bladder, there can be both deficiency and there's one deficiency pattern we'll talk about, and then two excess patterns. So the deficient pattern is bladder deficient and cold. And then the excess patterns are bladder damp heat or bladder damp cold. So there's two different kinds of cold that can present with the bladder, the deficient and cold or the damp cold, which is seen as an excess pattern. So you'll have signs and symptoms or signs that go along with those symptoms that point to an excess condition rather than a deficient condition, although things do not always play out like they do in a textbook, but you can expect to see and feel certain tongue or pulse patterns, which for more on that, you can check out my videos on tongue and pulse diagnosis. We won't go into that today. So basically all these patterns, their symptoms have to do with urination, so pretty straightforward with the bladder. So with the deficient and cold pattern, you're going to see more frequent urination, paler in color, right? Not like dark yellow, more pale or clear, and abundant also, just frequent, copious, clear or pale urine, or point to deficient cold. Versus damp cold would be more difficult urination, and so maybe like starting and stopping, or it may feel like there's some retained. There may also be like a feeling of heaviness that can point to, that always points to some kind of dampness, feeling kind of weighed down, bogged down. And then the other thing is that the urine itself would be cloudy rather than clear, as it is with deficiency cold. So may not be as frequent or as copious, at least not all at once. And with the damp heat, the urine would be darker in color, right? Indicating, most of us know that indicates some kind of dehydration. And also a burning sensation. So burning sensation usually indicates some kind of heat, and again, maybe difficult urination. So something like a UTI could be like a damp heat condition. So that's it for the bladder pathologies. And then just a note about, we talked about with the kidneys, they have a special relationship with the heart. And in the Shanghan Lun, or the treatise on cold damage, which was a really important foundational text in Chinese medicine. There's a whole school of thought that's based on it, and the idea that all disease is caused by cold, at least originally, and it outlines 6 stages of disease, which all involve a pairing of the 12 major organs / meridians. So the heart, kidney, or Shao Yin we talked about, and so I'll mention the bladder is paired with the small intestine, and this is called Tai Yang, or translated as supreme yang or greater yang. And so this is the most yang of the 6 stages. This is kind of where an external pathogen first meets us. And so yang is in relation to yin. Yang is more outward, more exterior. So hence that name, greater yang. And so this is like the very first stage of sickness from an external pathogen. So like with a cold or a flu, so some kind of infection that starts out, usually it's, people are not coming to see me when they're at that stage. Usually people will, stay home, try to rest, or just push through it. And so it's this very initial stage, but signs and symptoms would include, or could include, a stiff neck. So the bladder and the small intestine channels both go by the back of the neck, so there may be some kind of a stiff neck. Sensation, an aversion to cold, or feeling kind of cold, along with potentially a fever, not like too high of a fever, like a low-grade fever, but also maybe feeling averse to cold, and then a pulse that would be floating. And so you can check out one of those videos on pulse diagnosis for more about that, but essentially it's a pulse that you feel it pretty prominently on the very surface, but when you press down a little deeper, it just kind of evaporates. So it's kind of, that chi is coming up to the surface to contend with this external pathogen, but there's this underlying kind of weakness, and so that is it for the bladder, and we'll pause there, and I will be back in a moment for some acupressure points that you can do to support yourself through this time of year or any time. So I'll be back in a moment.